My family history is marked by issues of weight, obesity. My father and his sister are housebound as a result of it. Dad has diabetes, he has heart issues, and I sort of felt like I was next in line. It seemed as though my body was sort of stuck at 220. Dieting wasn't working, exercise wasn't working, and I felt as though I was rapidly running out of options. As I looked around, I felt like many of the other programs were very cosmetic, but Rush did seem to have the most holistic approach. They were, keen on surgery, but they were also going to back you up in terms of nutritional work and also mental health, which was so important to me. And with all of those factors in play, I did feel like that was going to lead to long-term success.
Like most patients we see, Katie had tried unsuccessfully to lose weight and keep it off with diet and exercise. That's not unusual. At Rush, all bariatric candidates undergo a comprehensive evaluation to see if they qualify for surgery. This involves meeting with a Rush nutritionist and psychologist to see if the patient is mentally and emotionally ready to undergo this transformation. Bariatric surgery is a commitment to changing your lifestyle. Here at Rush, we make sure you have the tools, the motivation, and the support in order to accomplish this goal. If patients return to bad habits, such as eating foods with high carbs, refined sugars, or experience lack of exercise, their bodies may react and ultimately they may regain their weight. Our team at Rush will support you every step of the way, starting with your first visit and continuing with your follow-up visits to ensure you have the best possible outcome.
I feel like a better version of myself. It was certainly an emotional ride, and I do have therapy weekly, but I feel like the support that I got, especially from Rush, and this messaging that nutrition and regular mental health check-ins would be an important part of my journey, I really feel as though that got me to where I need to be today.
Katie's been a great patient, and honestly, she's been a great advocate for herself as well. That's really important through this process because, as she would agree, it's not an easy journey. The dietary changes alone can be really challenging, so that's why we have a team in place to help each and every patient navigate and incorporate those new behaviors into their lifestyle, and this is something Katie's done seamlessly. This includes a full liquid diet before surgery and then for a period of 2 weeks after. Then we go to a soft, low-fiber diet and then the reintroduction slowly of solid foods.
I have lost 65 pounds. I will say the moment where it really hit home for me is I was on an airplane and I just sort of plopped down in the seat, and all of a sudden I realized, like, whoa, there's all this space on either side, and it was just a surprisingly emotional moment for me. It really hit home that things had changed. I know this sounds funny, but I do miss my old self from time to time. That's normal. I think it's natural to sort of mourn a way of life that you have experienced for so long. It's part of this process that kind of allows you to move into your new life more fully. I feel as though Rush really did prepare me for this. I am so glad that I did this. I feel as though it is truly an investment in my future.